Well, I'm Paul T. Lamin from the National Private Sector Health Workers Union of Liberia. The WAHO, West Africa Health Organization, had a whole week of activities. Well, the activity was climaxed by Health Minister Summit on the 11th and 12th. That was on Friday and Saturday. Now on the 11th, we assembled at the Golden Gate Hotel in Painesville, outside Monrovia, where health workers line up the gate entering the hotel from 8 o'clock in the morning up to 6 p.m. When the ministers were entering, we were there. And the ministers were leaving that day, we were also there. We were there when our health minister came and left. And we intended to draw their attention on those issues that we've been stressing a long time. And they've been playing deaf ears too, so we wanted to draw the attention of those visiting Liberia to see how best they can talk to our colleagues to solve our problems.
What are the kind of key issues that are confronting health workers at the moment in Liberia?
Well, we have been faced with several issues, but the most recent ones has to do with the death of two of our colleagues who were catering to patients affected with Ebola. They too contracted the disease and they died at a later date. Since then, the government has done nothing. The government has not even recognized the effort of these our colleagues. And we thought it was to call on the attention of those ministers who were visiting our countries. Since Ebola is not a one country thing, it's trans-border, we thought it was that they should know that health workers died saving patients from Ebola, and those health workers were not recognized. Their families have not even been recognized for the brave job done by their sons. We also were very concerned, or still remain concerned, over the $55 United States that were deducted from public sector health workers' incentive over the period of time. So we collaborated with our colleagues from the public sector to champion the cause for the reimbursement of the money worked over the period of time, and and to make sure that government constantly pay them what is due.
Is it true that health workers don't even receive salary slips in Liberia?
In most cases, they don't. They do go to the banks. Health workers are very concerned in the public sector that they do go to the bank. They don't even know the amount that has been paid until they get to the bank. And at the mercy of the bankers, they do know how much is in their account. And this is very grave, this is very serious. They take serious exception, we do take serious exception. And we're going to work with our colleagues in the public sector to make sure that is resolved.